is Ivy, and I'm a Purdue Northwest nursing student, and today I'm going to be demonstrating proper wound care and irrigation. To start, before I even go in my patient's room, I'm going to gather all the supplies I would need, perform hand hygiene, and look for what kind of precautions we would need. So for wound care, this is full contact precautions, which means I'm going to get into full PPE. So we'll start with that. Making sure my gown is secured at the wrists to not let in any unwanted germs. I will then secure my gown at the waist. After you put your gown on, you put your mask on, but my mask is already on because we are on campus. But as you can see, it is secured at ponytail level and around the neck. So after my mask would be on, I would put my gloves on, well, my goggles on, like so, and then my gloves. Making sure to pull them up the cuffs of the wrists. After putting my gloves on, I would go out and knock on my patient's door and identify myself. Hi, my name is Ivy. I'm a Purdue Northwest nursing student. I'm going to be doing a new wound dressing and wound cleaning. Can I see your ID band, please? And go ahead and verify your full name and date of birth for me. After identifying my patient correctly, I will then ask if they need any medications prior to doing the wound dressing procedure. If they needed oral meds, they would wait 30 minutes after, and then IV meds, we would wait 15, but Mr. Jones here does not need any medications here. So I will then go ahead and start my wound care. I will only pull back and expose what is needed as to ensure maximum comfort for my patient. After exposing, I will then take a disposable check pad in order to make sure I have a waterproof barrier here to not make a mess on sheets, and place it as close to or under the wound as possible. And then to remove the previous dressing that they already had, I will use the push and pull method, which I will push the skin and pull the tape to ensure as little pain as possible. After pulling the tape off, I will inspect for any drainage, any blood, color, odor, all that. There is none. I will discard into the trash. I will then, after this, take my ruler and measure my wound here, which is 14 by 3 centimeters. And then I will take a Q-tip and inspect the wound for tunneling and measure the depth. So please tell me if any of this hurts. And measure depth. There's no tunneling, and the depth of my wound is 3 centimeters. And then I will discard. After doing all that with the wound, I will discard my soiled gloves and then perform hand hygiene again, and then get ready to set up my sterile field for the wound cleaning and redressing. I will start by picking up the outside package of my drape, making sure that it is clean, not expired, and unopened. I then place it on my pre-cleaned surface, open away from me, being careful to only touch the 1-inch border around the drape because that is all we are allowed to touch. I will pick up a corner, hold it high up, making sure that it is in the air and does not come in contact, and then I will rotate, picking corners until the drape is open. Holding it up, I will take this package and discard into the trash, turning and carefully laying down. When throwing the drape package away, you need to be careful to only touch the inside sterile part as do not contaminate your hands. After setting up the drape, I will then start by opening my other sterile materials by holding them, pulling away from me, and dumping them onto your leg. So if they were to fall off, I would have to completely start over. So I will start with my ABD pad, open away, and dump, and discard. And then I will take my gauze pads, open away, dump, and set to the side because we will need that for irrigation. And then I will take my irrigation tray and open, and then place this underneath the patient's wound because we'll need that when we clean the wound. And then I will take my Q-tips, open away, and then dump like so. Discard into the trash. After that, I will perform sterile gloving. I'll come over here being sure not to turn my back on my sterile field, because if I turn my back on my sterile field, I'll have to start over. I will then take my package of sterile gloves, making sure that it is unexpired, dry, and unopened, and then place it on a clean surface, hold it away from me, carefully handling the inside package, and discard. Then take the package and open it away from me, making sure that the cuff side is facing myself. Carefully pulling open, grabbing the flaps, and doing like so. Then I will take my non-dominant hand and glove, making sure to keep hands at waist level to prevent accidental exposure. Repeating by touching only the inside sterile piece on that side. Pull up the cuff over the wrist, then take this hand and grab that cuff on the sterile side only, and do that. Grab only the sterile inside, discard. So then now I'm ready to set up my stuff for my sterile procedure. I will grab my saline first, but I will only use my clean hand as the saline is not sterile on the outside as to not contaminate it. So I will come over here, grab my saline and set everything up how I want it. My right hand is my sterile hand, so it is safe for me to touch everything in my sterile field after I just touched the saline with this hand. Now I will open my saline with my clean hand and set the cap upright, being careful to limit its time that it is open, as you don't want to contaminate it, and dump it into my containers. I feel like if that was in a real setting, I might have to start over because I don't know how frowned upon it is to dump things over. So then I will move my saline, still making sure not to contaminate anything, and then I will take this gauze and open it to make it just a little bit easier on myself and place it into my sterile saline and move that. So now I will begin the procedure. So first I will take my sterile hand and get ready to irrigate. I will put it into here, pull up some solution, and then trade it with my clean hand so I do not have to contaminate my sterile hand. Keeping my hands above waistline, I will put my syringe 1 inch above the wound and then clean back and forth, repeating that until the water runs clean. Then I will put this off to the side because it is no longer sterile as I touched it with my clean hand. And after that I will take a piece or two of dry gauze and dry my wound. Back and forth like so. And discard in the trash. After that I will take a Q-tip with topical solution or whatever is being used on the wound for the patient. Put it in my clean hand, not touching, and apply the solution like so and discard into the trash. After that, I will then get ready to pack the wound. I will take my gauze that I have soaked in saline here, and I will go ahead and wring it out. While I wait for that to wring out, I'm first going to grab the Q-tip, and then I'm going to transfer it to my clean hand so I don't have to reach over and do everything else first. Then wring out my gauze like so, and move over and get ready to pack my wound. I will then come over, and then taking the end of my gauze, I will put it in the wound and then pack. For as much as it takes to get it full. And then I will discard of the Q-tip. Then taking 2 pieces of dry gauze, I will place it over the wound, covering it. And then my ABD pad. And then once this wound is closed and covered, it then becomes a clean procedure instead of a sterile procedure. So I will go ahead and take the wound accordingly. Move my irrigation tray out of my way. Tape it up. Pivoting each time, not turning my back. And then I would take this smaller piece of tape and then I would write name, date, and time that I did the dressing on there. And that is wound dressing. And while I still have my sterile gloves on, after that, I will then take the ends of everything. And these are full of saline, but I would take everything, fold it up, and discard, and then take off my sterile gloves. Take off my sterile gloves, perform hand hygiene, and then PPE. But for the sake of this demonstration, I'm going to go back and backtrack because oh no, I did that in the beginning. My wound was already dressed. After hand hygiene, that's it.